It's an exciting new phase. We're all anxious to get back to work. We want to do it smartly. We want to do it intelligently, but we want to do it. And that's what this week is going to be all about. In terms of where we are, total hospitalizations, we're down again. That net change is down again. The net change in intubations is down again. The number of lives lost, still too high, obviously at 161, but better than it has been. So we see all the arrows are pointed in the right direction. If you look at the number of new COVID cases per day, about 488, that is just about where we started this horrific situation, right? So May 10th, we're right about where we were on March 19th, before we went into the abyss of the COVID virus. And when you see the number of lives lost, again, we're right about where we started before we really went into the heart of this crisis. And that's what it's been. It's been a crisis, and a painful one. But we're coming out of the other side. So in many ways, from my point of view, we're on the other side of the mountain, right? We got hit with the virus. We saw that incline. We saw the number of cases growing. We saw the number of deaths growing. We finally hit a plateau because we did what we needed to do, and we changed our behavior, and we closed down, and we turned the corner, and then we started to come down the other side, and that was the decline. And now the decline has gotten to a point where we are just about where we started the journey. So to turn to reopening, because we have abated the worst by what we've done, and now we can intelligently turn towards reopening. And that's May 15th, that's this Friday. And local regions all across the state should start to prepare for it, and people as well. And that's what we want to start to talk about today. We're going to open when we are ready to open. What does ready to open mean? Well, first, the number of hospitalizations, the infection rates show decline. The federal government, with CDC guidelines, have laid that out, and we think it's intelligent. We accepted the federal guidance. And we have testing, tracing in place in every local region. Testing and tracing, words we never really heard before this situation, but now people hear them every day. Testing, have the capacity to do enough tests, diagnostic tests, are you positive or you're negative, antibody tests, did you have the virus, and have you resolved the virus? Have that testing capacity in place. Tracing, when you find a positive case, trace it back, and then isolate the positive so you reduce the spread. Sounds simple, logistical nightmare, never been done before, but that's what testing, tracing is all about, and that has to be done region by region. That capacity has to fit every locality. We talk about being New York tough, and what tough really means, and the second word in New York tough is always smart. And we have been smart through this, and we have to continue to be smart. There are 7 metrics, if you will, to get it down to a quantifiable situation that each region has to look at. First are the infection rate, the number of hospitalizations, the 14-day decline in hospitalizations, or under 15 new hospitalizations. That means you're controlling the hospitalizations. New hospitalizations under 2 per 100,000, so you know that the virus, again, is under control. Then number 4, let's learn from the past. We had a true public health emergency that we were in danger of overwhelming our hospital capacity. Let's make sure we have 30% buffer in a number of available hospital beds in case that virus takes off again on you. You want to make sure we have hospital beds, so hospitals up to 70%, but 30% available hospital beds, 30% available ICU beds, Many of the people who come in with this virus need an ICU bed. We want to make sure we have the ICU beds if we need them, God forbid. And then testing capacity so we know what the virus spread is doing. You don't know what the virus is doing unless you are testing. And then the tracing that fits with the testing program. We've been doing more tests than any state in the United States of America. So New York is way ahead in what we're doing on testing. We've come up to speed faster. We're doing more tests per capita than any country on the globe. So we're doing very well in that regard, but you need it in every region. It doesn't help the Finger Lakes if the Capital District has enough testing. You have to have enough testing and enough tracing in the Finger Lakes. So each region has to have that in place, and we understand that.